We are living longer. By 2030, a quarter of Americans will be 60 or older. Never before will so many people reach their 70s at the same time. But with age, chronic health conditions increase dramatically, causing new concerns.
There are more than 78 million baby boomers in the U.S., the first of whom will turn 65 in 2011, and on average can expect to live another 18 years after that. The unpredictable costs of illness and treatment, including prescription costs, are the baby boomer generation's biggest concern and fear.
Statistics show that by the year 2020, baby boomers will account for 4 out of 10 visits to physicians, and by 2030, 6 out of every 10 will have more than one chronic condition. Each new illness and hospitalization brings more concerns about the cost, availability, and effectiveness of prescription drugs that will be required.
As physicians try to overcome the twin challenges of delivering high-quality care cost-effectively for their patients, there's 2 very important things that they need. First of all, they need the medication history information, what drugs their patients have received from the pharmacy or been prescribed by other clinicians, and information about their drug benefits so that we can deliver the high-quality, cost-effective care that the patients deserve and our society needs.
With increased costs and a recent rise in medication errors, many people feel it is time to connect the prescribing process through sharing drug history, pharmacy benefit, and prescription information.
The electronic prescribing industry is a fairly new industry. It's been evolving for about 10 years. The need for electronic prescribing has emerged because of the increasing complexity around drug benefits. And a couple of things that are addressed with electronic prescribing are patient safety. We get information in the hands of doctors so they can make better decisions, as well as cost information so that the drug that is selected for the patient is as effective from a cost perspective as possible.
Having real-time access to patient healthcare coverage and medication history at the point of care enables clinicians to make informed prescribing decisions that are appropriate and cost-effective for the patient.
Electronic prescribing makes writing prescriptions easier for physicians. They have 3 crucial elements they need when they write the prescription. They have the patient's medication history, they have drug-drug interaction information, and finally they have benefit design information so they can write the right prescription the first time every time.
Electronic prescribing provides the opportunity to increase patient safety, reduce costs by electronically transmitting prescriptions to the patient's choice of pharmacy. Pretty soon, 1 out of every 5 Americans will be over the age of 65, causing growing concerns about the availability and soaring costs of healthcare and prescription drug coverage. RxHub's e-prescribing services can tackle these problems head-on.
The electronic prescribing industry is made up of 2 major components. The first component is checking the benefit for the patient before writing a prescription. That includes reviewing medication history and the formulary for the patient, and then routing the script electronically to the pharmacy of the patient's choice.
RxHub is the nation's leader in providing true end-to-end e-prescribing services. It is a national network exchange for the flow of vital patient information to physicians and other healthcare providers. This improves the continuity of patient care and allows prescribers to make informed prescribing decisions that will keep patients safe, yet reduce costly errors and adverse drug effects.
Electronic prescribing has significant benefits for pharmacists, including reducing input for new prescriptions, eliminating unnecessary calls and faxes to physicians for refill requests. But most importantly, it prevents misunderstanding and potential errors associated with illegible prescription information.
RxHub partners with stakeholders in the healthcare industry to improve patient safety, increase workflow efficiency for prescribers and pharmacies, and reduce the overall cost of healthcare for everyone.
Our mission is to accelerate electronic prescribing. Our objective is to provide the standard communication hub so all interested parties in the electronic prescribing food chain get the information they need when they need it.
The month following Hurricane Katrina, the number of patients entering emergency departments in Indianapolis from Louisiana and Mississippi increased nearly 6-fold. RxHub was critical in making sure they got the health care they needed.
Electronic health records are often touted as one of the solutions to providing access to patients' critical health information after natural disasters like Katrina. Here in Indianapolis, even patients who didn't have the benefit of an electronic health record were able to receive high-quality, safe care after that event by accessing their medication histories through the RxHub system. And not only was that a great benefit to the care providers, but to the patients as well.
The electronic prescribing industry is a fairly new industry. It's growing pretty rapidly. The need for electronic prescribing has emerged because of the complexity in healthcare around drug benefits. And what we bring to bear is greater efficiency in terms of cost, as well as in terms of patient safety through the use of electronic prescribing tools.
To learn more about RxHub, call the number on your screen or log on to rxhub.net.